So people often ask, how did we get from being in a hospital that was 93 years old to being in this new hospital? And the process actually began in early 2004 when we completed a strategic plan to try to figure out what the future for our organization would look like. And one of the needs that we identified was to replace the existing hospital. There were a whole host of needs that were identified when we were thinking that through. The biggest one was being sure that we had a facility that could accommodate the growing population in our service area, that could enable us to introduce new technology, new ways of delivering care. In designing the hospital, our purpose was to reduce infections and to improve clinical outcomes and increase patient satisfaction with our services. When we were making design decisions and investment decisions, they were all based on their ability to help us achieve those goals. Because we were able to acquire 171 acres, we've been able to do an awful lot more than we had ever certainly originally intended. So in addition to the acute care hospital, we'll have our own power plant. We'll have a 150,000 square foot medical office building. We'll have a fitness and wellness center. So hopefully we've been able to create a terrific new hospital, a health campus that I think is going to be unique in the country. We'll have virtually every level of care that people need, and it'll all have been created at the same time. So I think that's going to be a great benefit to the people who use us. And then we've got the elbow room that's necessary to expand. With all that this project represents, the most exciting thing about it to me is that we finally have a building that's as good as our staff. We realized that just being an average new hospital, which is a big deal in itself, wasn't going to be good enough for us, and turned us on to the opportunity to do something really special. And hopefully we have.